Bonjour, Madame. Agada été?
Celestine Akassa is a licensed nurse, but she hasn't been able to find a paying job. So she works as a volunteer in this private hospital in Yaoundé.
We don't have enough equipment to do the treatments. We make do with whatever's at hand.
According to the World Bank, Cameroon's unemployment rate is 4%. But Celestine says the country's healthcare is ridden with precarious contracts and poor working conditions.
We have 22 patients in the room, and we only have 4 nurses. It's not enough. Sometimes I want to ask, what do we do with these nurses who are unemployed, who don't have a job? And why do we burn out those who are already working in hospital?
There is work for Celestine, though, in a country where her skills are highly sought after. Canada, more specifically the province of Quebec, which has launched an international recruitment campaign. They're looking for French-speaking nurses.
I'm really interested. We've heard about the program already. Maybe working conditions are better than here. And maybe the work experience too. How to practice better, learn even more, improve.
Celestine hopes to soon be able to afford the application fees for the program. Others have already taken the plunge.
Things are going well. The training is almost over. So here we are, going to the hospital to truly kick things off.
Ornella Kyoulgakamdur is now living in Rimouski in central Quebec.
It's been a really enriching experience so far.
Ornella is one of the initiative's first recruits. She came to Quebec a year ago. While she's enjoying her program, she says cultural differences and the weather have come as a shock.
At the beginning of the fall, it was cold. It wasn't easy and came as a big shock to me. At home, people told me, when you go, it's not going to be easy. It's a new culture. There are people who will be racist. It's true, but there are exceptions. There are times when you're made to feel like you're not at home. But I found people who are very welcoming, whether in school or in the workplace.
Ornella is a licensed nurse in Cameroon, but she has to complete training and pass an exam in order to practice in Quebec.
Je ne sais pas si vous voulez me démontrer comment on l'utilise au Québec.
Oui, le spiromètre, en fait, c'est pour améliorer la respiration.
This is where Ornella and the other African nurses in her class have been training for months.
Je peux mettre la force d'aspiration à 1500 voire 2000 en fonction des capacités du malade.
Practices are similar, but not the tools.
Whether you're in Africa, America, or in Europe, the science remains the same. We learn the same things. It's more about the materials. Here it's more specific to the situation in order to make the tasks easier.
The training is free. Every student also gets a stipend of $500 a week until they take the final exam. In exchange, graduates commit to working for at least 3 years in the region.
We would like to know, how long after we start working can we take leave or go on vacation?
Generally speaking, the collective agreement dictates that usually after a year of work, you have the possibility of having up to 4 weeks of vacation.
Quebec's first recruitment efforts focused on Europe. Most nurses came from France and Belgium, but the local government was forced to widen its horizons, looking to other Francophone countries in Africa to recruit talent and meet the labor needs for an aging population.
For several years, we've been having around 70 nursing positions that we need to recruit internationally for. It's to make up for the shortage based on maternity leaves, retirement, and sick leaves. Typically, before, we only recruited 2 to 3 nurses from abroad, particularly from France. This time around, we recruited 36 people, so for us, it's definitely very important and it's impressive.
Quebec's plan is to attract young African caregivers by offering competitive salaries, but money is only a hook. The real challenge is to make the newcomers stay and integrate.
They went to climb a mountain very close to here to create this team synergy. I find it really beautiful because it happened maybe a few days after they first got here.
Heidi Kim Ferguson is in charge of the program. Most recently, she's also taken on the task of helping with the integration of foreign students.
They're well integrated. They're already working in the hospital and doing their part. And then people are grateful to see them arrive on site to lend a hand.
The government is investing $65 million over 2 years in this initiative. They want to train 1,000 nurses by 2025.
I would like to see what the future holds for me in this city, in this country, and in Quebec.
The next round of foreign nurses is expected to arrive in training centers like the one in Rimouski in 2024.